When considering breast augmentation, there are a number of decisions we have to make. Firstly, we need to choose an implant. Now, implants have a number of characteristics that can vary from one implant to the next. The first and most obvious will be shape. A lot of implants are round, others are shaped a little bit like a teardrop, and it can be called a teardrop or anatomical implant. The next feature that's evident is the surface of the implant. So most implants we use these days are smooth, but there are textured implants. But historically, textured implants were used in far greater numbers in Australia than the surfaces that we use now, which are smooth. And we'll talk about that a little bit later. The gel on the inside of the implant, because almost exclusively we use silicone implants rather than saline implants, the gel in the implant has different firmness. So for some implants, if you hold the implant up, the gel will sink towards the bottom of the implant, much like a breast, and they tend to give a softer, more natural appearance. Others have a firmer gel so that when you're upright, the round shape at the top of the implant is maintained and therefore can give more obvious fullness in the upper part of the breast. In general, when we're choosing an implant for an individual patient, apart from the goals, some people might want to be a little more obvious, others might want to be a little more natural, but apart from the goals, we're often trying to match the type of implant with the nature of the natural breast. So a softer breast after breastfeeding, we'll tend to use a softer implant. For someone who's not yet had children, has quite a firm breast, and particularly if they're also after quite an obvious outcome, then we use a firmer implant. But these aren't absolutes. We also need to consider things like the breast shape. Is the nipple low? Is it pointing at the ground? In other words, do we need to combine implant surgery with a breast lift to bring the nipple back up into the centre of the breast, to have it pointing forward and not looking down, and to control the amount of skin overhang in the lower part of the breast onto the chest? If these are primary concerns, then a breast lift may be what we need to consider. And there are a number of different types of lift we do, some with an incision just around the nipple, others with an incision around the nipple and then another incision going down to the fold under the breast. That one, although there's a slightly longer scar, has much greater potential to control breast shape, particularly overhang. Occasionally, we'll also consider using fat graft. Fat graft is useful for people with a wide cleavage so that we can narrow the cleavage. It's useful for people with developmental breast problems like tuberous breast, or perhaps even for someone with breast asymmetry, where we may either approach that with different sized implants or perhaps use fat graft into the small breast to make the breasts more even and then use same size implants. So these are the decisions we need to consider when we're considering breast implants for improving breast shape and size.